So first, before we went to the patient room, we checked for any precautions, medical history, anything we should know about.
It's not like my.
Then we entered the room, right? And hey, my name is Victor. I'll be a student nurse, and we will put it on a urinary catheter. And then we ask name, date of birth. Then we check it with the ID, verify. And then in case you have any questions, like hey, any questions, anything you know about, and let them know this procedure will be uncomfortable, so please work with me because I will try to make it as fast as possible. Then what we're gonna do is, well, first of all, never mind. I was gonna put on sheets, but first of all, put the bed in a higher position so it's more comfortable to work with. It's gonna take a while. Should be good enough. Alright. And we take this weight down. And since I'm gonna touch the patient, I'm gonna wash my hands. Where's the disinfectant?
Oh, right behind it, on the under the bed, bath blanket.
Disinfectant, right?
Nah, you're good. Alright.
Then we're gonna get a blanket. Sit down. And we're gonna touch the patient directly. So we're gonna need some gloves for that.
That's what I did.
Then first thing we're gonna do is ask them to stretch their legs, but since they can, I'm not gonna do it for them.
Go ahead.
And we make them open like in a frog position, kinda like this. So we have some proper space and nothing gets in the way. Good enough. Then we wash the perineal cavity, but before that, just as a preference, put like a blanket on top of them so they're not that cold. Something, let's set up like this, one like this. Or this works better. Then we're gonna put a straight or beneath this mess. Below them, just just we're gonna wash them so it doesn't wet the bed. And then just open it well. And then we're gonna wash them. Just grab it. I think that's it for this one. Grab it, hold it in three. And then hold it again. And what we start is we wash the meters in a circular angle. And then we wash the shaft from the inside to the outside. Like this. And now that it's all washed up, throw this away. And this is when the sterile technique comes in. Because what we're gonna do is we're gonna whip out the Foley catheter.
Oh, okay.
We would throw it in the trash normally, but reusable stuff, so we can open this.
Oh, we have this on the side, don't we?
And just put the piece away. Put it on the away. I'm going to away. Sterile gloving, very important. Throw this away. Grab the edges. Stretch it out. Alright, stretch it out. And, this one gets stuck. There you go. Open it.
We could have used that vacuum pipe.
Open it. I don't know what's still fighting now. Open it without touching the middle inside. Then grab a glove.
Nah,
I am your group professor now.
yeah.
Where's the thumb? Like, messed up. Alright, give me a second. There we go. And scoop technique. Back from here. See if we can open it. Work. Okay. get to it. We grab this one just by touching the outer layer. We open it, and then we want the shiny part, which is this one on the downside. So do something like this without touching the patient and without touching the drape too much. Then we're gonna take this one, which is the white one, and the same thing, shiny part down, and we put it down. This will be our workstations, very important. We got this, got the outside, same as last one before, shiny part, and this one put it on the area, like this. Good enough. And then we ask for, hey, any allergies to latex, iodine, everything we should know about. Patient is allergic to iodine, so the iodine, we take it out. We're gonna use hydrogen peroxide, but first off, well, I'm gonna rip it apart and fluff out these cotton balls, then put it on the cotton balls, and then make sure they're like, well, they absorb it. We throw this out. Then grab this thing, put it right here. Just sort of, no, I put the lubricant on the other one, so, you know. So if I remember right, the first thing we're gonna do before anything is, well, grab the patient, like this. Then, you know, wash them down, lubricate them,
No, I'm saying the one that goes around the other drape.
and then I'm gonna put that in my room because I think once I put the hand down, I'm not supposed to take it. So I'm gonna put that for my learning.
I hear that.
I would give it a
And we're gonna take it out,
You go like that.
right?
So like my thumbs.
So we're gonna grab the syringe, open it already,
So like.
put it in, and then slowly we're gonna like
Gloves are touching the inside, and then you.
intersect this across our fingers, take it out, we throw it in the trash,
I just learned that yesterday. I
put it
should
on the
try
legs.
it.
Well, we're gonna put finally the lubricant. Oh, this way. Just put it right here. Throw this in the trash. We let it sink down for a bit.
Yeah. So.
We let it sink down for a bit, I said.
I was saying, yeah, he's.
And
So try.
good enough, I think.
I don't, or even.
And then we put it inside, right? This is where we finally put one hand on the patient and we never let the hand go. And this hand is gonna do nothing but, you know, push it, push it, push
Keep the
it.
legs straight, she's saying like this. But you're at least put them like this. Yeah. Have space right here.
We push it. And we wait until we see urine backflow. Then once we see the urine, we put like 2 more inches,
I think the way that.
right?
I mean, I don't know if it grab
And then we're just gonna grab this and we're gonna grab the syringe, inflate the balloon, some little bit of pressure, but nothing too crazy. And we disconnect this thing, right? This thing we throw out, but we tug out this thing just to make sure it's well placed. It is well placed. So now we grab this. Right, I'm gonna put it right here because now I'm gonna take up my gloving. And let's say that's a trash, but you know, we can't really throw it. And then we're gonna grab this thing,
Because I want it to be like this.
put it on the thigh.
Stick it under, and then it's gonna. Because right now you're not there. Yes.
Where's the thing?
There you go. Yeah.
What was it this way? No, it was this way.
And anyways, you're gonna. You don't have to air smell.
And then we just tie this thing to the thigh. I think it was this way that we were supposed to tie it down. Right, now that's over. What we're gonna do is, well, wash your hands again, and then from this little bag, we're gonna take a sample. The way we take the sample is through this little tube. Take this, open it, Close it real quick, cause the flow is gonna be real quick. Close it.
Oh, yeah.
And the second one we can get a sample is to get an injection and inject it like right here and just take it out, which we good.
Yeah, but I don't know
Now,
the wording that she was
what's the name? Then once we lift the room, we're gonna put this put the position. But now since we're gonna remove it, what we're gonna do is grab some gloves.
The hydrogen peroxide and the compound, you only specific orders.
Also, wait.
I'm sure we did that.
I don't know about that.
So you should do that first. You should move
Taking
the
this off is simpler than putting it on, honestly. I just need to look for the syringe, which should be, let's say, in the trash because I threw it there. Syringe.
I asked
Don't
them
low
to-
our end.
Right.
I couldn't.
First of all, grab this right here, just to prevent blood flow. Let me just.
I think the way she told us was this is closer.
We prevent blood flow with this, and now we just put this on the inside. And that's it. Actually, yeah, I don't do nothing. We just let gravity do its own thing. And oh wait, I think I messed up. Yeah, I'm supposed to have like a little air bubble, like this, and then we put it on, and we just let gravity do its own thing. Yeah, now we do nothing but wait. I don't think I missed anything so far. Well, I think I missed some stuff, but I did make sure, like, to say that, hey, I missed this.
Mm-hmm.
I bet if you don't do that, it'll be wrong.
So the first thing you're supposed to do, so I'm just gonna go off the record so you know. So
Just wait it out.
did that, adjust the bend control, did that, place it, do the checks. Is this
You forgot
removal?
to put the
Oh wait,
checks.
this is removal. Oh yeah, the check.
You leave it.
I mean, it's gonna take a while. But let's just say, for the sake of the patient and the video, since it's a mannequin, it should be faster than real people. On real people, we're just gonna grab it just for this video and slowly deflate it. Because otherwise, we're supposed to just let it, do its own thing. But I think it's the mannequin that just doesn't work that way. I'm not too sure. Now we have our syringe full, and the balloon is, off. Disconnect it. And then we're gonna let them know, hey, please take a deep breath. And then we're slowly gonna pull it off. Right? It's off. Then we're gonna untie this thing, which should be like this. And then we grab this thing. And I think we check for, did we check for anything in the back? Because I remember checking, I think it was odor. Wait, what's it? I think it's type. No, that's, well, type, odor, amount, and any irregular we can find. We find nothing, alright, we just throw it out. And then we say, we offer perineal care, and they, they decline because it's a mannequin, I doubt it can talk. So, I'm just gonna take the stuff away, take the drapes, and the way I'm gonna do it is just fold everything neatly, and just throw it away. And then you just lay them down. Ah, yeah, I got my finger in there.
I didn't put it on this bad. I was going to put it on
And
the
take this thing off.
everything else right.
I have a lot of my stuff over there on the table. I need to fix it. Cover them again for privacy purposes, and then put this thing up again.
We're gonna like after I realized that I had to
And all we're gonna do
say that.
for the end is, well, take the gloves off, throw them away. Right system.
Yeah, I don't actually.
And hold the better glove position. And that should be it. We just let them know, like, hey, any questions, concerns, anything you know about, then I put the call line,
Most like how would you do it?
well, for them to reach, and that should be it. Let me know when you start recording.
Okay, good.
Alright,
Wait, it's
so
just when you're like this.
before we enter the patient room, we gotta check for, medical history, precautions, anything we should know about.
That makes
Then
sense.
we enter the room.
I just thought
Then first thing we do is,
right,
well,
no, that
hey,
makes
my name is
sense.
Victor, I'll be your student nurse, and I'll be in charge of putting your
Right.
whole catheter.
I'm calling off like.
And I
No,
let them
no,
know,
it
like,
makes sense
hey,
because, yeah, because
what's your
then
name and
I
date of
would've-
birth, right? We wash your hands, and then I check it, And then any questions, anything you want to know before we start? No questions, okay, we move on. So we let them know, hey, this will be uncomfortable, but we're gonna do what we can, right? To make it like go as fast as possible. Bring gloves. We take this thing off. Place the drape. Right. So first thing what we're gonna do is, just as courtesy, we're gonna put this over them so they're not cold.
Oh, just gonna pretend I am. Okay, so.
And this is gonna ask them to put their legs in a frog stance. This.
I would just say box. Yeah.
And then, I don't think I need to raise the, well, I'll go raise the bed. I thought I could make it do without raising the bed. but I guess I can't. So just for now, I'm gonna have to remember to put it down. Yeah. Then let's put this thing down.
Alright, so I walk in and just wait for the patient.
And now I got that hat. I will offer the ring up here.
Latex
Well,
tie-dye.
before the ring up here, put this straight so, you know, the bed doesn't get wet.
Oh, right.
I gotta spread the legs of the mannequin a little bit more. Good enough.
We have good lighting.
Alright. And look at this thing. Tie it around the hands. Right. Then we're gonna start from the inside to the outside, all the way around. Good enough. Put this in the washer. Take this things off. Throw it in the trash. And we're gonna wash our hands again, just in case. I wonder how many chemical like burns am I gonna get from washing my hands? This is a curiosity. And we take the folly out there. Put it on. We grab the folly. Put it right here. We open it. And open it so these things are away from us. So grab it, shift it, open it, grab it, shift it, open it, and then the final turn and completely open. Grab the gloves, right? Ground them always by the outside layer. This, open it, grab it here, open it. Oh, I opened it upside down. Because I packaged them wrong, so that's on me. This here real quick. We open it without touching the inner layer, just like 1 inch of the actual gloves. Grab a glove, put it on. I say put it on. Scoop method. Put the other one on. Got it. Alright, then let's move on. The drape, shiny part. Hold on. The shiny part of the drape, which is this one, we're gonna put it touching the floor, so like this. I might adjust it a little bit. I might have to move this. Seeing as we have like this whole thing, I don't think this is necessary. But I'm gonna put it just in case. Same as always. Open it. Shiny part down. I would have broken so early because I technically touched it. I'm gonna be so honest. Also, if it feels like I'm lagging behind my speech, it's because my wisdom teeth started to hurt, so I'm trying to like kind of rush this. But all I think I still can speak. The same thing with this. We put it over. Good enough. Any allergies to iodine, latex, anything?
Yes, iodine.
Iodine. Okay, so we got the iodine. We're not gonna use it. We'll throw it away. Anyway. Oh, there's a mess with my sponges, so I'm also fluff them up while I'm like fixing the positioning. And the things I'm gonna do is grab this thing, open it, put it on the cotton balls, throw it, grab the lubricant, open it, put it right here, this whole line. throw it. Fluff out these things. Make sure they're like, you know, well combined with the hydrogen. Then we're gonna move this part over here. And this is for the specimen collection. We're not gonna use it yet. However, this is the main thing we're gonna use. We're gonna stretch it out. And we're gonna go to syringe. Open it. Put this away. Trash. Put this thing inside. Oh. Put this inside. And then what we're gonna do is we're gonna grab it like this from our 2 fingers. Wrap it around your fingers. Trash. Put it on the lubricant that we put beforehand. Let it well lubricate. Then with the same hand, we will grab a different one. We're gonna grab this thing and just, you know, lubricate the whole patient.
Oh yeah, this is a over here.
And the last one. Good enough. And then we're gonna grab this thing again. We're gonna move this thing away. Very important, once we put our hand on, we're not allowed to use it again. So we're gonna put it down, open the lips, and then just slowly put that inside. Well, we let them know like, hey, please hold your breath, and there will be some discomfort. So we try to put it in as fast as possible. I feel like putting a woman is way easier than a guy, just for the mannequin type. It might just be me though. Now that it's all inside. Well, most of it, because, you know, we don't want to put the whole thing because the uterus is, well, not the uterus, the bladder is smaller. We're gonna check for urine. There's urine, okay. Now we'll put the water. And there it goes, there it goes, there it goes, there it goes. Okay, quickly disconnect it. This. And we're gonna throw out these gloves. Which I will actually do this time. I'll wash my hands over there and put on new gloves. Do this real quick. Okay. So we'll grab the band. Here's the band. So, you know, everything's already set up. We just need to grab this. Tie it around them. Like this. Put it more on that side.
I have like 5, so I just took a brush.
This.
So now
This. I suck at putting these things on. I need to practice that.
okay, so
Alright, good enough, right?
Mm-hmm.
We'll put this out right here. And what we get a specimen is, well, I'm gonna erase it. Is through this thing with this cup. We're gonna, you know, open this, use the cup, put it right here. And we're supposed to empty it, but we're supposed to do it real quick because the urine is really fast. So we leave this right here. We want a second sample. What we can do is take it from here, from here, and we just put a syringe, pull it out, and we're good. So the way to take it off is, first of all, I'm gonna untie this thing. Take this thing off. Right. Before anything, I let the patient know that I will be removing it. And now, here. I'm gonna grab this. Okay. Put it like this, so blood flow stops. Grab the syringe we used previously. Put a little bit of an air bubble in the inside. Good enough. And then we just stick it in. And this is the fun part because we get to do nothing. We just wait. I'm gonna grab my finger like this, so maybe the gravity helps it. I think I'm just gonna yank the water because by the time it gets done, it's gonna take a good minute, and it's not like I can do anything in the meantime, you know.
The truck too. Yeah.
So just for this video purposes, I'm gonna,
So now I'm over here.
you know, take the water from the mannequin myself. Usually it's faster than a human being, but I think it's because of the mannequin, or I don't know, just doesn't want to work with me.
I don't put on no
Right.
pair of gloves technically, right?
Look at the water. So the water balloon is deflated. I'm gonna take this off. And I'm gonna let them know, hey, please take a deep breath, and then we'll just take it off.
Right. Okay. So
Ooh,
I'll
that was
put on
nice.
gloves.
And then we're gonna check for the urine, which, you know, we check for amount, odor, clarity, and anything we should know about any irregularities. Hopefully no kidney stones, so we're good. This we just throw out. So we grab these things and throw this out. The whole grapes, and just throw them out too. Hey, and then we offer, you know, perineal care. Hey, decline. Okay, that's fine. We're gonna take this off. I have a lot of mess on this table. We just ignore that. It's supposed to be trash. Legs. Then ask them to put their legs down, but since, you know, mannequin, I gotta do it for them. Great. And then we just cover them up again. And yeah. If you have any questions, anything you want to know about, anything you should know, let's say no. Okay, now oh. Okay, get stuck with all that. Then we put the bed in the lowest position, put the collar, and that should be it.
All right.
Hello, so this is for my things I could have done better, right? The questions. Well, 3 reflections. In itself, we're supposed to ask 2, but I feel like I did more than 2. So to explain, first off, sterile technique. I feel like I broke it, kinda, multiple times. Not really, well, not multiple times, but I know 1 or 2 at least with the male. Because with the male, I feel like I did more clumsily compared to the female, but the male definitely that. And the fact that, what's the name? I kinda got lost in the steps, as in like, perineal care at the same time, the other lube at the same time I'm holding my hand. It was a lot that I was not supposed to do, which I ended up accidentally doing, right? Then again, also, my bad, like disclaimer warning, if I sound weird and if I be like clenching my mouth, but my wisdom teeth are still hurting, so I did panic during the male because it started hurting and I wanted to like stop talking as fast as possible so it would stop hurting. For 2, right? For female, I feel like I was more confident. However, I do want to improve sterile technique, just in general. And 2, which would be, it hurts. Well, for male, I can think of again that instead of putting the legs like frog legs, which I call them, because, you know, frog limb, you're supposed to just have the legs down and just push them apart. And honestly, that was simple. However, I forgot about that, and for female, I also need to learn to, what was it? It was something, I just forgot. When I'm wiping it down, I'm supposed to hold it open. I thought I did, but I'm supposed to leave my hand in there. I just did for like a second, cleaned it, and took my hand from there. I mean, of course, I had the pressure so it wouldn't move, but still, I was supposed to open it, and I forgot to do that. So I feel like those are all. And those are all that I can speak right now because it's hurting. And yeah. So yeah, tomorrow I have a validation and I want to see how that goes. So I think those are the things. Well, at least I say 2. I'm sure I have more, but regardless, I'll just look at the feedback for the video and see what happens.